Signs on pharmacy doors telling customers no COVID vaccines are available yet point to just how hungry people are to get immunized against the disease.
It obviously can't happen soon enough for many of us.
Dr. Carl Fichtenbaum is an expert on infectious diseases at UC Health. He knows better than most when COVID vaccines could arrive in our region and who's expected to get them first.
There's a lot of people, and it's going to take time to get enough vaccine available. It is a math problem.
Healthcare and emergency response workers, along with nursing home residents and older, more vulnerable people, will be first in line to get vaccinated, ideally in a few weeks, and presumably with either Pfizer's or Moderna's double-dose vaccine. Combined, Fichtenbaum says that's around 850,000 people in greater Cincinnati. Multiply that by 2 and you're looking at the need for 1.7 million doses of vaccine. When the distribution process begins, he thinks our region will have a long way to go.
Our area is probably going to get a shipment somewhere in the neighborhood of 20,000 doses to start with.
Fichtenbaum says he doesn't yet know how many more doses will be available starting in January.
The promise was 100 million doses of each of these vaccines to the federal government, and we'll just see how long it takes to get them. And I know everybody wants to jump on board and be a part of the solution, so hopefully we can get it done as quickly as we can.
Now, adding to this new form of vaccine math is how long it will take for someone who gets a double-dose vaccine to be immune to the virus. Fichtenbaum tells me it can take 28 to 35 days to be immunized, so even the small number of people in our region who may be vaccinated this month wouldn't have full protection until potentially late January or early February. Todd Dykes, WLWT News 5.
Yeah, now Todd, a couple quick questions for you. The talk about kids, what's happening with them, we know how much this impacts schools, but then the question is how long until there's enough doses for everybody?
Yeah, those are questions we all want answers to right now, right? But of course, it's going to take a minute. Dr. Fichtenbaum does think vaccines could be given to kids as young as 12 once people in that first tier have been vaccinated. For children younger than that, he would like to see more data, so we'll keep you posted about that. As for when everyone else might have access to the vaccine, well, Dr. Anthony Fauci, a member of the White House's coronavirus task force, says that could happen by May. Fichtenbaum said that seems reasonable if all goes according to plan. Stephen?
Yeah, the important if all goes according to plan. We'll look forward to May. Todd Dykes live for us. We appreciate it.